It's time to get your medical questions answered live. Dr. Zorba Pastor is standing by at his office in Oregon. The number to call 270-9933. Hi, Zorba.
Hi, guys.
You want to talk about the coronavirus a little bit?
I do. So when we talk about the coronavirus, before that, let's talk about the elephant in the room, which is influenza. So 2 years ago, influenza killed 60 to 70,000 people in the U.S. And that's the really important thing before we do corona, because the risk of influenza is far greater than the risk of coronavirus. So if you haven't gotten your flu shot, get it. It reduces the risk that you'll die or be hospitalized with influenza by 60 to 70%. So it's a pretty good shot, not 100%, but hey, that's really important. Now, coronavirus. I just got off the airplane from Colorado and I saw people with masks. Masks are pretty useless. Why? Because you breathe around the outside of the mask. Unless you have a perfectly fitted N95 mask, which is a special mask, it's really not going to protect you. But the thing that tends to protect you is this, hand sanitizer. Hand sanitizer makes a huge difference in whether or not you're actually going to get a viral infection, because what happens is we touch our nose, we touch our face, touch other people. That's really your best protection. So get a portable hand sanitizer, use it on your hands all the time. That's your protection. And right now, pay attention to what's going on. As you know, in Wisconsin, we've got known cases of coronavirus, but it appears that the people are they're in their houses, they're not going outside, they're self-quarantining, and that's really the way to keep this under control. The real issue is in China and not in Wisconsin.
All right, let's get to the calls. We'll start with Dorn in Baraboo. Hi, what's your question?
Yes, per doctor's orders, I'm detoxing off of duloxetine. And I want to know how long these side effects, like my dizziness, my unstableness, is going to last. I'm taking two 30 milligrams in the morning and two 30 milligrams at night. So I'm taking 120 milligrams a day. So, doctor, I want to know how long these side effects will affect me.
Well, first of all, when you duloxetine is a very good antidepressant that's used in chronic pain. You're on the maximum dose, which is 60 milligrams twice daily. That's a hefty dose. That's not a small dose. So what you want to follow is a good method of decreasing the duloxetine. And generally, that would mean cutting it from 60 milligrams twice a day. The next week, you would take 60 in the morning, we'll say 30 in the evening. The next week, you would take 30 in the morning, 30 in the evening. And the next week, you may take 30 daily. But you've got to talk to your pharmacist, you've got to talk to your doctor and determine exactly how slowly you have to get off the medication. It's a very good medication, so don't just take my advice there. Talk to your doctor and your pharmacist. But generally, it takes about a month to get off the medication completely. And once again, you're on a high dose, and that's one of the reasons you most likely have side effects.
All right, don't do it on your own.
All right, let's go to Kathy in Janesville. Hi, Kathy. What's your question?
Yes, I was wondering. I had the influenza last week, and I'm off of medicine now, but I still got this, like, cough. And I was wondering if I can get the flu shot, because I haven't had it in 70 years. I've been avoiding it, but I was so sick this year. I'm wanting to get it, and I want to know if I can get it or if I've got to wait till that cough is gone.
Did you have influenza proven by a test, or did you just have the symptoms of influenza, which usually is a pretty good moniker of having?
I went to urgent care, and they said I had the influenza.
Sure. After you get better, I would get the influenza shot if it were me. Why? You may have immunity. You probably do have immunity from it. The shot isn't going to hurt you. If you got it, you're going to protect yourself in case you get it again. Can you get it again? Absolutely. How likely is it? I don't really know how likely it is with this particular strain, but the answer is yes. I would definitely get the flu shot after you feel better. And remember, next year, in September, in October, get the flu shot and give it every year for the rest of your life. That's important. Influenza kills.
Does that drug you could take when you first get the flu, does that help at all? The one that cuts, was it Thermoflu?
Well,
Tamiflu.
It helps with the symptoms. Tamiflu helps with the symptoms, helps decrease a number of the symptoms, makes you feel better, doesn't really cure it, but it definitely helps you get better. We also use it prophylactically in households so that other people that you're around in your household are not going to get it. In nursing homes, for instance, I'm medical director in Oregon Manor in Oregon. If one person comes down with influenza, we treat everyone in Oregon Manor because the prophylaxis with Tamiflu is really quite effective.
All right. Let's go to Ron in Merrimack. Hi, Ron.
Hello.
Hi, what's your question?
The question is, I have a problem with my prostate, and I've been given pills from my doctor that aren't really helping. And I see advertised super prostate pills that are advertised on TV that you can buy at the local drugstore. And it was supposed by a Harvard doctor that
Sure.
that was
so first of all,
advertising.
let me talk about advertising. A Harvard doctor. Who knows who that is? And they're telling you a Harvard doctor recommends it. It's over the counter. Save your money. Generally, those medicines do not work. Talk to your doctor. There are a variety of medications for your prostate, and if not, consider a surgical procedure if you're still having symptoms. But if it's done by, quote, a Harvard doctor, I don't think it's worth it.
Yeah, infomercials, probably not. All right, Zorba, thank you.
You bet.
Thank you, everyone, for calling in. We'll do this again soon, and we'll have a final check of your forecast coming up.